So good evening all the participants and the doctors. I, Shuman, on behalf of Shield Healthcare, welcoming you all in today's session on a very emerging topic, that is bacterial vaginosis. And our guest, today's speaker is Dr. M.T. Bello, madam. It's my honor to introduce madam, Madam Dieter DNB, MD of Dr. Bello's clinic, Dimapur, Nagaland. Madam is the president, KOGSO in Nagaland Obstetrics and Gynecology Society, and she is the joint secretary, NPDA, and executive member, Northeast Chapter, Indian Fertility Society. So with this short introduction, I request madam to take over the session, and meanwhile, I request all the participants for your active participation. And please post your queries on the QA dashboard of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with madam. So thank you very much, madam, once again for your valuable time on our platform Shield Connect, and with such a nice, important topic. And thank you very much.
Thank you. Good evening, respected seniors, colleagues, friends, postgraduate students. Thank you all for being with me in this program today to discuss bacterial vaginosis. And I also thank Shield Connect for this platform. And this is such a common topic which we encounter every day in our chamber. And it is just a recap. Everybody knows what bacterial vaginosis is. And we will have a little recap about this topic, bacterial vaginosis. Let us begin by understanding what a normal vaginal flora is all about. Now, many different bacteria inhabit the vagina, especially the lactobacillus, and this protects the vaginal epithelium. It secretes hydrogen peroxide and creates an acidic medium, which actually acts as a disinfectant to maintain normal balance of organism in the vagina to diseases. Now, any condition that changes this vaginal acidity or disturb the milieu of the vaginal epithelium may cause infection. So we have to understand that there is a fine, delicate balance between the two major organisms normally found in women throughout their reproductive years. The two main types that we know is the Candida, which we commonly see, and the Lactobacillus. They are always competing with each other to invade the vaginal epithelium. So here we have the ecosystem in the vagina. The estrogen, the pH in the vagina, and the vaginal flora all have their work in the vaginal epithelium. And as we all can see in the diagram, the lactobacillus will increase the lactic acid lactic acid in the epithelium and decrease the pH. Now the normal pH is 3.8 to 4.5. Anything below 3.8 and anything below 4.5 is going to tip off the balance and cause disturbed epithelial or vaginal epithelial milieu. Now the hydrogen peroxide that is produced by the lactobacillus, it inhibits the pathogenic bacteria. This whole cycle protects the vaginal epithelium from diseases. Now, a lot of byproducts in the vaginal flora protect the woman from getting diseases. And the main one is the lactobacillus, which maintains a vaginal low pH, and also the lactobacillus, which produces the hydrogen peroxide. It inhibits the HIV virus in vitro. Women colonized with hydrogen peroxide, they producing lactobacillus, are less likely to have shift in flora, protecting the epithelium. Now, there are many reasons why a woman can get vaginal infection, the most common is poor personal hygiene, using too much soap, overweight, uncontrolled diabetes, wearing clothes that are too tight, uh, which uh, which actually we recommend using more skin-friendly clothing, use of feminine deodorants, doubting and scented sanitary products, excessive use of antibiotics and hormonal contraceptives, stress, change in sexual partners, and multiple partners, pregnancy, recent childbirth, menopause, inadequate sleep, poor nutrition, all of these contribute or increases the risk to vaginal infections. Now, what is bacterial vaginosis? One of the most common complaints a patient comes with. It is caused by a change in the type of bacteria found in the vagina. Normally, bacteria belonging mostly to the Lactobacillus family, they live harmlessly and produce chemicals that keep the vagina mildly acidic. In bacterial vaginosis, lactobacillus bacteria are replaced by types of bacteria that normally are present in the vagina. Now, as we have already seen before, the risk factors, the most common is the history of multiple partners, a new partner a new partner or cigarette smoking, vaginal douching, the use of copper devices, and most of these are actually related to sexual activity. The CDC states that any woman can develop Gardnerella regardless of whether she is sexually active. However, sexual activity and level of sexual activity does seem to be a factor. Women who have multiple sexual partners are at a higher risk, and women with new sexual partners are more apt to develop Gardnerella as well. Now, how serious is bacterial vaginosis? Now, Gardner and Dukes in 1955 gave us the reasons in obstetrics and gynecology. In obstetrics, we see women who have had abortions, whether it is early, late, or recurrent, preterm birth, premature rupture of membranes, postpartum endometriosis, chorioamnionitis. And in gynecology, women who frequently get urinary tract infection, post-abortal sepsis, pelvic inflammatory disease, post-hysterectomy vaginal cuff infection, women with infertility, and acquisition of sexually transmitted infections, which can be either bacterial, protozoal, viral, HSV, HPV, and syphilis. Why is bacterial vaginosis poorly understood? Now, the thing is, we all know what it is, but we also don't know what it is. So the microbiology is quite inconsistent. It is difficult to diagnose, and uh, inconsistent response to antibiotics make failure of treatment and frequent recurrences. There is inconsistent outcomes. You may treat, it comes back again and again. It comes back after treatments in 3 to 12 months as well. And the usage of boy toys also contribute, or surgeries can contribute. So it has a wide array of presentation. It is difficult to understand. It is either overdiagnosed or underdiagnosed. Now, how is it relevant in pregnancy? Pregnancy, of course, is a stressful state. It is a fragile state, and it often occurs during pregnancy, which can lead to premature labor and delivery. premature rupture of membranes, and even postpartum uterine infections. Women with a history of premature labor or other complications must be checked for bacterial vaginosis even when they don't have any symptoms. When a patient comes with a complaint of bacterial vaginosis with the symptoms they present to you in your chamber, especially in the first trimester, we have to be wary and careful that they do not end up in late second trimester miscarriages and preterm labor. It is very common to manifest vaginal discharge in pregnancy, and we have to keep all this in account and do a proper vaginal examination. Women with previous history of 2 trimester loss of preterm delivery should be examined for bacterial vaginosis, and if found to be positive, they should be treated with metronidazole, which is safe in pregnancy, which I mean to say is in the second trimester of pregnancy. Avoid large doses of the medication. What is Gardnerella vaginitis? It is a gram variable staining rod anaerobic bacteria. It actually has gram positive cell wall, but because the cell wall is so thin, it can either appear to be gram positive or gram negative under microscope. It is very small in diameter and it is non-sporing, non-motile Phocobacilli. It was previously known as Haemophilus vaginalis. Now, how do we grow this Gardnerella vaginitis? It can be grown in either a blood medium called the HBT agar or commonly the chocolate agar. And they form small circular convex gray colonies. And this can also cause bacterial vaginitis in some women. And it can also be isolated from several areas. Typically, it is isolated in genital cultures, but may also be found in blood, urine, and pharynx. Now, how does it look like under the microscope? The most important finding is the presence of flu cells. And they appear, last slide, please. They appear like pleomorphic rod, which shows metamorphic granules, and they are small gram-negative motile organisms. Now, the simplest way to diagnose bacterial vaginosis, the gold standard, is gram stain. As discussed already, we are able to culture this in both blood and chocolate agar by catalase and by oxidase. What are the symptoms a patient comes with? Remember, 50% of women diagnosed with bacterial vaginosis do not have symptoms. If it does, an unpleasant fishy vaginal odor and a white or yellow vaginal discharge is the complaint. For most women, these symptoms are more so after intercourse. How do we observe the vaginal discharge? They may be thinner than cheesy, which is the finding for Candida. The Candida discharge is more thick. Bacterial vaginosis usually does not cause significant irritation compared to candidiasis. If you have these symptoms, your doctor will check for other possible causes. There is no perfect test, but if you have symptoms like discharge, itching, pain while urinating, or odor, then that is actually the diagnosis. There is no perfect test to diagnose bacterial vaginosis. A very important finding is a vaginal examination. Now, how do we diagnose this? When we talk about pH, we are actually using litmus to test the pH. pH below pH below 3.8 or above 4.5, causing shift in vaginal flora, will change the color of the litmus and help us to diagnose. Now, there is a color reference chart for pH, and with that, we can understand the pH. Fishy odor when a sample of the vaginal discharge is combined with a drop of potassium hydroxide on a glass slide is also one of the diagnoses. The diagnosis on the microscope, as we know, is clue cells. These are what? These are vaginal skin cells that are coated with the bacteria. How do we treat? How do we treat bacterial vaginosis? We all know commonly we treat them with metronidazole or clindamycin. And we have the other azoles that you can use, tinidazole, secnidazole. You have oral medication, you have pessary, you have creams you can use. And for those that are allergic to metronidazole, you can give azithromycin, doxycycline, clindamycin. You can even use the ceftriaxone and cefixime as well. These are used in various preparations, and the patient is advised accordingly. However, the US Centers for Disease Control and Prevention recommends that all pregnant women with symptoms be treated with oral medications because medications are safe. The dosage, as we know, of the various medications that are commonly given, metronidazole, 500 milligram orally twice 7 days, or you can use gel applicator vaginally once a day for 5 days, clindamycin cream 2% vaginally at bedtime for 7 days. The alternative regimes are tinidazole 2 gram orally once daily for 2 days, or 1 gram orally once daily for 5 days, clindamycin 300 milligram orally twice for 7 days, or you can even use ovulus clindamycin intravaginally at bedtime for 3 days. Please remember, while we are prescribing metronidazole, tinidazole, secnidazole, we are to tell our patients to avoid alcohol because they react. And clindamycin cream can weaken the latex. So additional precaution needs to be taken when prescribed with clindamycin cream. Studies show that a 7-day treatment with oral metronidazole or a 5-day treatment with metronidazole vaginal gel is equally effective in non-pregnant women. Clindamycin vaginal cream is slightly less effective than either type of metronidazole. So the preferred medication would be metronidazole. So as we have gathered information about bacterial vaginosis, antibiotics and antifungals remain the mainstay of therapy. The recurrence rate is high. As I said before, it can, after you treat a patient, within 3 months, the patient comes back to you and say, I have not been cured. It can happen, recurrence rate is very high, and it is associated with other side effects. Kindly treat urinary tract infection as well. When you see the patient, run the test so that you can treat both together. What is the role of probiotics? Live microorganisms, which when administered in adequate amounts, confer a healthy benefit on the host, says World Health Organization. Many types of microbes are available. They're commonly the lactic acid bacteria and bifidobacteria. These are also commonly found in food like yogurt, dietary supplements. Why do we need probiotics for infection treatment? New problems created by antibiotics, with usage of multiple antibiotics, recurrence, the usage of multiple antibiotics can cause uh, recurrence, disruption of the protective flora, antibiotic resistance due to overuse, and the interest of usage of ecological methods and running out of antibiotics is why we may resort to probiotics. What is the rationale behind using vaginal probiotics? There is a clear hypothesis about the role of lactobacilli. We all know that lactobacilli occur naturally in the vaginal epithelium, how it protects the vaginal milieu, the clearly established protective role, and and uh, and because these probiotics are easy to perform in clinical trials, sampling is easy re-isolation of probiotic lactobacilli after application, and because it is readily available, both synthetic and naturally. Various studies, uh, have shown that biological control of vaginosis helps to improve women's health. The Indian Journal of Medicine in 2014 also says that exogenous strains of lactobacilli have been suggested as a means of re-establishing a normal, healthy vaginal flora. Carefully selected probiotic strains can eliminate bacterial vaginosis and also exert an antiviral effect, thus reducing viral load and preventing fetal and neonatal infection. The administration of beneficial microorganisms, which are the probiotics, can aid recovery from infection and restore and maintain the vaginal epithelium. We have another study from the Human Reproduction 2016. The study of abnormal vaginal microbiota may be associated with poor reproductive outcomes. In the summary answer, it says the vaginal microbiota of IVF patients can be characterized with qPCR tests, which may be promising tools for diagnosing abnormal vaginal microbiota and for prediction of clinical pregnancy in IVF treatment. These are not commonly done, but these are studies showing how useful probiotics are and how it can save a pregnancy from premature delivery. Now, various clinical studies have shown the cure rate by using probiotics. In the first study, the vaginal capsules using 10 to the power 8 to 10 to the power 9 colony forming unit Lactobacillus acidophilus, there was a 21% cure rate compared to 0% in the control group. Vaginal capsules introduced 1 to 2 times daily containing at least 10 to the power 7 lactoacidophilus and estradiol for 6 days has a cure of 88% compared to 22% in the control group. Daily vaginal capsules containing 10 to the power 9 colony-forming units of Lactobacillus rhamnosus and 10 to the power 9 colony-forming units Lactobacillus reuteri, which are used twice a day with metronidazole gel for 5 days, a cure of 66% compared to 33% in the metronidazole group treated. Vaginally introduced capsules containing 10 to the power 9 colony-forming units of Lactobacillus brevis, Lactobacillus salviarus, and Lactobacillus plantarum for a period of 7 days showed a cure rate of 50% compared to 6% in the control group. So here, as we all know, even clinical studies have shown the positive effects of probiotics in the use and treatment of bacterial vaginosis. To conclude, the use of probiotics, as already shown in the studies, is well established. The abnormal vaginal microbiota composition has been shown to lead to preterm births, miscarriages, and problems with conceiving. Women with an abnormal vaginal microbiota are roughly 1.4 times less likely to have a successful early delivery, early pregnancy development after IVF treatment when compared to women with normal microbiota. Thank you.
Thank you very much, madam, for this nice presentation. And just give me 1 minute
Thank you.
time, madam, to check if any question is there in our dashboard. Ma'am. Just give me 1 minute time. Madam, one question is there any difference in the treatment strategy if one woman got this BV in case of early pregnancy and in case of late pregnancy? What will be the difference in the treatment approach? Is there any?
As we have already seen in our slides, when it depends on when a patient comes in the first trimester with the complaints, we need to examine the patient and assess the severity of the infection. Most of the antibiotics are safe to use in past the second trimester. We can use, as CDC says, metronidazole is safe. We can use in the second trimester. For first trimester bacterial vaginosis, preferably vaginal insertions will be safer over oral medication. I have personally used vaginal inserts for first trimester pregnancies.
Sure.
And I have not seen any third trimester premature delivery so far.
Okay, madam. And ma'am, this probiotics, how long these probiotics can be given? Is there any norms or something is there?
The longer you give, the better it is. But an average 2 weeks to a month is good. It suffices. And we have to improve the general well-being of the pregnant woman if we are talking in terms of a pregnant patient.
Okay, madam. Sure, thank you. And ma'am, another question is, is there any way to reduce the chances of recurrence of this bacterial vaginosis? Is there any lifestyle modification, or you can say some other precautions need to be taken care of to reduce the chances of bacterial vaginosis?
See, when a patient comes in and we take a detailed history of her medical illnesses, we need to control her diabetes if she is overweight, the way the clothes that she wears, very tight clothing, or synthetic clothing, all this has to be advised. Not to use too much of talc, because a lot of women use talc for scent, to avoid use talc and deodorants, and to maintain personal hygiene. Essentially, these are very simple things we ask our patients to do, which they are able to do and relieve their symptoms.
Thank you very much, madam, for this nice deliberation. And I could not find any other question, madam. So if you allow me, then we can conclude this session now.
Thank you so
Yeah,
much.
thank you very much.
Ma'am, myself, hello, am I audible? Ma'am,
Yes,
myself,
yes.
Bharat here. So if you
Thank
allow
you,
me, I
Bharat.
will ask. Yeah, ma'am, I'll ask one question, ma'am, from my side.
Sure.
So if you allow me, thank you, ma'am. So, ma'am, which age group patients are more prone to develop BV?
See, the reproductive age group are the most common, even though now I frequently see a lot of young girls, even 6, 7 year olds having some form of vaginal discharge. But of course, I do not classify that as a bacterial vaginosis. But the most common age group is the reproductive age group. And women with multiple partners usually suffer from this condition.
Okay, thank you, ma'am. And one more thing, ma'am, generally antibiotics you don't prescribe, generally recommend during pregnancy. So what if in case of pregnant woman is suffering from BV? So what is your treatment charge? Whether you are including antibiotic plus probiotic, probiotics alone.
It depends on the severity of the disease. I may just go with because most of the time when they come, they also come along with what do you call a urinary tract infection. So while you are treating the urinary tract infection, considering the category B drugs, you're actually even treating the bacterial vaginosis that you encounter during that time. So while you're examining a patient for bacterial vaginosis, send a urine test, and if the patient has urinary tract infection, you choose a safe antibiotic to cover both, because you're able to use ceftriaxone group even in the first trimester, so it kind of covers the bacterial vaginosis as well. So if you don't want to use metronidazole and any of the other groups you feel is probably not safe in the first trimester, then you can also use the ceftriaxone group while treating these patients in the first trimester.
Okay. Thank you, ma'am. A little deeper, I'm asking one more question, ma'am. So especially when it comes to trimester, 3 trimester, so which trimester is, where women develop this bacterial vaginosis?
See, they can develop in all stages of the trimester, but of course, they present most of the time, they come commonly in the first trimester and
Thank
also
you.
in the last trimester.
Okay, thank you, ma'am. And one more thing, ma'am, do you know that, as you know that probiotic market is evolving, specific strains are
Yes.
evolving. So when it comes to specific strains, how do you believe when it comes to newer specific strains, madam, when it comes to treating bacterial vaginosis?
So many strains have come in the market, and the common ones that we are using are the lactobacillus rhamnosus. So that is the most common one we are actually using, but most of the combinations come with several other colonies also. So we are using the good brands. I'll not promote one brand, but that is
Yes,
the ones that we are using. Yes.
Yes. Thank you, ma'am. Thank you for addressing my queries, ma'am.
Thank you so much. Thank you, Shield.
Thank you very much, madam, for your value.
Thank you so much for sharing your
Thank
valuable
you.
time.
Thank you so much.
Thank you, ma'am. Have a nice evening.
Thank you.
Thank you. Have a wonderful evening.
Thank you.